Hi, my name is Michael Tang. I'm a dental surgeon at Complete Dentistry in Paisley, and in this presentation I would like to talk you through a sinus lift procedure. The aim of this video is to give dentists who may be interested in this field of dentistry, to give them an insight into what a sinus lifting procedure is, and also to give patients who may be interested in the procedure a little bit more information on what this procedure is all about. This is a patient who is concerned with having missing teeth in the upper left side of her mouth. At the moment she wears a partial acrylic denture, which is a basic plastic denture, but the patient cannot cope with this because of its removable nature and instability. We can see here from a different angle the missing area, missing teeth, on the top left hand side, and you can see here where we're pointing to, this area here is actually quite a thin boned area. So you can see the bone here seems to be quite bulky, and then it dips in here. This area is actually okay. So the area near the back is quite thick. The area near the front is quite thin. This is using a mirror to reflect the upper teeth into this image here. You can see the missing teeth here. Two missing teeth, two premolars. And you can see in the palate here, the hard palate, a line, a U-shaped line all the way across. And that line is created by the plastic denture. So wearing the denture for prolonged periods has created this indentation. And basically the denture would cover this whole area. So this whole palate here pretty much is covered. So there is loss of the sensation of taste, the sensation of temperature, etc. when eating. And you can imagine if the thickness of the plastic around here affects speech, etc. So that is why the patient would like to pursue the possibilities of dental implant procedures here. So again, a clearer view of the side here, showing the big dip here. Now this X-ray shows quite clearly the two teeth for the back, two big teeth here, and this bright white areas here actually relates to the metal fillings that you saw previously, the black metal fillings. So this is near the front of the mouth here, and that's near the back. Now, when we took this X-ray, we can see here, this white line is actually the edge, the kind of lower part of the sinus. So this black area here is actually air, and this spongy, fuzzy area here is bone. Now there's two missing teeth here, so the plan is to place two implants. So one here, and one around here. That kind of idea. So the first implant placed near the front, just behind the canine, you can see is completely encapsulated in bone. The second implant is partly sitting in bone around here, and partly sitting in this black space here, which is air, which is not ideal, of course. So we use the DASK system, the DASK kit, which is a Dentium Advanced Sinus Kit. Dentium is a South Korean company, so this system was designed by this particular company. There are many methods of carrying out a sinus lift procedure, and this is one particular way of doing so. So after anaesthetising the area with plenty of local anaesthetic, we raise the gum. You see here, we carried out an incision here, all the way around the canine, across the crest, and further back, and we raise the gum up here, and what we see here is actually bone. This circular shape has actually been created by one of the DASK dome burrs. This is bone, and what the DASK dome burr does is it removes a window of bone. So what you see within this circle is actually the sinus membrane, which is a very, very thin skin. The idea of a sinus lift is to lift this membrane up and then to fill the void that's been left behind by raising the membrane. We do not want to perforate the membrane, so this is a very delicate procedure. Now you see the membrane seems to have this black circle, black edge around it, and that's because we have now started to release the membrane. The membrane is actually stuck to the bone in the inside. To raise it, we need to release it. We need to gently peel it away from the bone. So we've started that, and that's why you're starting to see a black border. So it's peeling away. And now you see as if the membrane is sunken in, and that's because we have used the DASK instruments and released the membrane all the way across from this edge into the inside, and slowly working across like so, and back all the way around. So now the membrane is actually very loose, and you can see there's no perforations. Now once the membrane is very loose, this can be pushed up, and then the resultant void filled. This is a slide showing that hole now, that void filled. So the hole is still there, but it's just actually filled with this white granular material. This white granular material is a product called BioOS. It's produced by a company called Geisslich, and it's actually medical grade cow bone. So it's treated cow bone, it's particularly specifically for medical use. So that's that filled. You now see on the left hand side of the sinus hole that I created, 3 smaller holes. So what we've done here, we've punctured the cortical plate of the bone here. And why have we done that? Well, we've punctured the 3 holes here. We've punctured the bone to allow some bleeding, to allow growth factors within the bone and bone cells to come out. And the idea behind that is because we will now lay bone over this area as well. Earlier I mentioned that the bone here was quite thin. There was a dip. You could evidently see a dip there. And to fatten up the bone, to make the bone wider for implant placement in the future, we're going to carry out a bone augmentation procedure here. So we fill the bone in the sinus and we place bone over this area as well. This is the BioOS. You purchase this in vials. The red vials contains bigger granules and the green vials smaller granules. Once the bone is in position, we need to place a barrier membrane. You see here this white skin we place over the bone. The purpose of the barrier membrane is to prevent soft tissue from growing into the bone graft. Gum cells, skin cells and soft tissue cells grow rapidly, much quicker than bone can grow. Therefore we must protect the bone. So this skin here is actually a collagen skin, a collagen membrane. It is also produced by Geisslich, and it is derived from pigs. So it's a pig collagen skin. And this will stay around this position for about 3 to 4 weeks, and during that time it dissolves on its own. So that's enough time just to protect the initial stabilisation phase. BioGuide comes in a sterile pouch. It's very flexible. And there's usually a rough side. There is a rough side which faces the bone, and a smooth side which faces the gums. So once we've carried out the procedure, we replace the gum. Across the crestal cut here, this is actually one suture. I know it looks like there's several, but it's a continuous interlocking suture which runs across this cut here and tied there. There's two further sutures, these are called interrupted sutures, and one near the back here. So in actual fact, a large site like that only required 4 stitches. And this is 1 week after the operation, and you can see how well everything's healed. The gums have now returned to this pink healthy look. The stitches here are 4O Vicryl sutures. They will dissolve on their own within the next few weeks. In simple procedures, I would probably remove the stitches after a couple of weeks, but in a procedure like this, I would prefer to let the Vicryl sutures dissolve on their own. If you remember from the previous x-rays, you saw a black void around this area. Now you don't see the black void. It is grey or white, just like in the neighbouring bone, and that's because we have lifted the sinus membrane up and filled the void with the bioos, the bone granules. So now, if we were to place implants in those positions, they will be surrounded by bone. However, I would prefer to leave this now for about 9 months or so to allow the bone granules to settle and allow our own bone to integrate and grow around the granules. You see here the pre-operative x-ray on the left and the post-operative x-ray on the right. This black void, this air sinus, has now been lifted up to about this level here and then filled with bone granules. Without carrying out this procedure, it would not be possible to place 2 implants to replace the 2 missing teeth. As I mentioned earlier, this is a very brief overview on a sinus lifting procedure, and I hope it's provided an interesting insight into the procedure itself. For patients who are interested in this procedure or have decided to embark on this procedure, I hope it provides a little bit more information on what the treatment involves, how the surgery is actually carried out, because I think it's very important for you to understand before you decide to proceed with this type of treatment. And also, as I mentioned earlier, I hope it provides an insight to dentists who are interested in this field or simply require further information about this type of procedure and able to discuss and explain the procedure to patients. Thank you.